Do you need this back? All right, so. Just because this is on video, can you see it?
Oh, yeah.
Oh, okay. Your face, I thought that like his shoulder was in the way or
Oh,
something.
no.
Okay. So last time I saw you, this was a big stinking hole in your foot.
Yeah.
And you ended up in the emergency room. And they admitted you. And then they took you in and did a big surgery to clean it all up.
Yeah.
All right. Do you have a big dressing on it?
Yeah, there's
Okay, then
dressing underneath.
Yeah, I don't think I want to take that off because the other doctor is following you, right?
Yeah.
For the surgery?
Yeah, I go back on Wednesday.
Okay, then I'm just gonna wrap it back up.
Okay.
Yeah, if she wasn't following you, then I would certainly take over and take it all off and take a look, but I don't want to step on her toes.
Okay.
So we'll go ahead and take care of your nails today. And so I'm glad that that's all healing up okay.
Still a little drainage.
I would expect that.
Okay.
And that's actually good because you don't want it to all dry out.
Oh.
If it dries out, it's not going to heal. So.
Still have stitches in there from
Okay.
the surgery.
All right. Again, I'll let her take care of that. If
Yeah.
at some point you'd rather I do it, that's fine.
I will be back.
Yeah, and you know, you don't have to worry about hurting my feelings or anything like that. The goal is we want this to get better. So I don't care who does it, and so don't worry about that. All right, so how are you feeling now? Are you feeling?
I feel much better than
Okay,
I
good.
did.
Yeah.
I actually didn't know how much that infection was affecting me because I set my medication up once a week in one of those things.
Mm-hmm.
Not one day was right.
Oh,
And that's the only thing I can think it could be.
it very well could be. You know, infections can, when it's as big as that sounds like it got. You know, when I saw you, it wasn't that big, but it was completely appropriate to go into the ER and let them admit you and stuff. So, but you know, it's like with elderly people, when they start going goofy,
Yeah.
oftentimes it'll be like a bladder infection.
Oh.
And, you know, they don't know that.
Uh-huh.
And you wonder if they're getting dementia, and it turns out that they've got a UTI or something, you know? So yes, infections can do that.
I have to go in for, it'll be 2 weeks on Thursday that they started doing the IV.
Is that a PICC
medicine.
line?
Yeah. It's a PICC line. I didn't know what a PICC line was until they did it. But I have to go for at least 6 weeks.
Mm-hmm.
And if it could be extended to 8.
Depending on if the bone. Now, did she have to take out any bone?
No.
Oh, okay. So she just opened up the soft tissue, cleaned it all out.
Yeah.
That hit the ceiling. Okay.
Yeah, she said it was in the marrow too. Is there a way you can tell that?
Yeah, with the MRI.
Oh, okay.
Yeah, because the MRI will show where the fluid is. And you shouldn't have any fluid inside your bones.
They asked me if I was diabetic several times, so I don't know. They didn't say that it did, but
Okay.
they kept asking me that.
Can I step out for a minute?
Yes, and go sit down.
Mm-hmm. Sorry.
No, that's fine.
She ill?
A little squeamish.
Oh,
And I think all the talk about the infection and the surgery just
Oh.
kind of. You know what, let me just make sure she's sitting down.
Okay.
While I-
my plan is, I'm just gonna let the doctor that did all this finish up,
And that's perfect,
and I'm gonna schedule, for my next nail clipping today.
perfect.
Went quite a ways over the 9 weeks this time.
Well, first there was COVID,
Yeah,
then you were in the hospital. Well, I'm glad you're feeling better, and this is gonna be okay.
yeah, me too. I was really afraid I was gonna lose my foot. The way they were talking, they had me scared.
Well, I guess the lesson to be learned is, you told me it was a few weeks before
Yeah.
you came in.
Yeah,
And so, if there's a takeaway, it would be don't let it go that long.
yeah, never again.
Yeah, because this foot's gonna kind of be your Achilles heel.
Okay.
And, you know, anybody who calls the office and uses the words infection or open sore or wound, I'll get you in that day.
Okay. You know, my concern, even though you had told me to go to the emergency room, was I just wanted to make sure didn't want to jump the gun kind of thing.
In your case, well, I didn't tell you, it was Dr. Felton, right?
Yeah.
You spoke with my partner?
Yeah,
Yeah, it's, in this kind of a situation, I would rather be safe than sorry. And, you know, just because of the potential dire consequences here,
uh-huh,
it's, yeah, just err on the side of, oh, she's gonna tell me it's nothing,
okay.
okay? For example, patient I did surgery on last week
Uh-huh,
called me over the weekend and said that she was having a lot of pain behind her knee and that she felt like it was hot and swollen. Now, the chances of it being a blood clot in a young woman who could move her foot afterwards,
uh-huh,
slim to none. But I said the consequences of it possibly being a blood clot after surgery are so big that I think it's important for you to go to the emergency room and let him do an ultrasound and tell you it's nothing. And that's what she did.
okay.
So,
Did they hospitalize her then? Or-
no, when I send people to the hospital for a ultrasound
Uh-huh,
to rule out a blood clot, what I tell them is, listen, if they let you go home, you know it was negative. The
Oh,
technician
okay.
can't tell you, but if they let you go home, you know. So I will never say, oh, you shouldn't have come in.
Okay.
I will say, better to err on the side of caution. Glad you came in. It's fine. Okay?
Yeah,
All right, my friend.
good to know. Does it look like I have athlete's foot?
I don't see anything that looks like athlete's foot
Okay,
on either foot.
good.
And all this yellow stuff is the betadine from the surgery.
Okay.
And that'll wear off eventually, so. Looks like it was a little abrasion, like they scraped it during surgery probably.
Yeah, I was wondering what that was.
Yeah, it's fine. It's healed up. Okay, I can help you with your socks and shoes and
This is one of those, I don't know. Wasn't quite sure how to do that, so.
I'll show you. All right. So you put that on, and then you take this part and you turn it around a few times. Make sure that the knot is on the top. There you go.
Oh, great.
Your other foot, do you have a sock?
Yeah.
Okay, so any problems, you're welcome to call.
Okay,
Otherwise, we'll see you back in about 2.5 months.
sounds good.
Okay. Thank you for letting us do the video.
No problem.